What are the overlapping symptoms of OSA and ADHD? Have you ever wondered how sleep apnea and attention deficit hyperactivity disorder might be connected? It's fascinating to see how two seemingly different conditions can share similar symptoms. Let's break this down together. Obstructive sleep apnea is a condition where breathing repeatedly stops and starts during sleep due to airway blockage. This leads to disrupted sleep and lower oxygen levels. On the other hand, attention deficit hyperactivity disorder is a neurodevelopmental disorder marked by difficulties with attention, impulsivity, and hyperactivity. Despite their different origins, these two conditions have overlapping symptoms. Poor sleep quality and oxygen deprivation from obstructive sleep apnea can affect brain function in ways that resemble symptoms of attention deficit hyperactivity disorder. One of the main overlapping symptoms is difficulty focusing and maintaining attention. Individuals with obstructive sleep apnea often struggle to concentrate on tasks, leading to a shortened attention span and distractibility. Impulsivity is another shared symptom. People with sleep disruption from obstructive sleep apnea may exhibit impulsive behaviors similar to those seen in attention deficit hyperactivity disorder. Hyperactivity and restlessness also come into play. Sleep deprivation caused by obstructive sleep apnea can result in increased restlessness or hyperactive behaviors, which can be mistaken for the hyperactivity associated with attention deficit hyperactivity disorder. Emotional regulation problems are common in both conditions. Individuals may experience irritability, crankiness, and difficulty managing their emotions. Memory issues and forgetfulness are also prevalent. Cognitive impairments like forgetfulness and brain fog are often seen in obstructive sleep apnea due to poor sleep quality and low oxygen levels, resembling memory difficulties linked to attention deficit hyperactivity disorder. Behavioral challenges are another area of overlap. Problems with organization, task completion, and general behavioral control can occur in both obstructive sleep apnea and attention deficit hyperactivity disorder. The connection between these conditions arises because obstructive sleep apnea causes fragmented, non-restorative sleep and intermittent drops in oxygen levels. This can impair brain areas responsible for attention, impulse control, and emotional regulation. This overlap can sometimes lead to misdiagnosis. It's also important to note that individuals with attention deficit hyperactivity disorder are more likely to have obstructive sleep apnea. Untreated obstructive sleep apnea can worsen symptoms of attention deficit hyperactivity disorder due to chronic sleep deprivation. Recognizing these overlapping symptoms is essential for proper diagnosis and treatment. Addressing obstructive sleep apnea through appropriate therapies can improve sleep quality and reduce daytime cognitive and behavioral symptoms. This may even alleviate some attention deficit hyperactivity disorder-like symptoms caused by poor sleep. Evaluating sleep health is a vital step when someone presents with symptoms of attention deficit hyperactivity disorder, especially if sleep disruption or snoring is reported. The overlapping symptoms of obstructive sleep apnea and attention deficit hyperactivity disorder include issues with attention, impulsivity, hyperactivity, emotional regulation, memory, and behavior. These shared features highlight the importance of considering sleep apnea when assessing attention deficit hyperactivity disorder-like symptoms.